Digoxin is a medication that has been used for centuries in the treatment of heart-related conditions. It helps to regulate heart rate and improve the efficiency of the heart's contractions, allowing for improved heart health and reduced risk of hospitalization. In this video, we will explore the many benefits of taking digoxin for heart health and how it can help reduce mortality rates. What is digoxin? Digoxin is a medication that is used to treat congestive heart failure, atrial fibrillation, and other heart conditions. It is derived from the foxglove plant and can be taken as a pill, injection, or intravenous infusion. Digoxin helps to regulate heart rate and improve the efficiency of the heart's contractions, allowing for improved heart health. How does digoxin work? Digoxin works by blocking sodium and potassium channels in the heart muscle. This helps to reduce the rate of electrical impulse conduction, allowing for improved heart rate control and more efficient cardiac contractions. Digoxin also helps to reduce the amount of calcium released from the cells in the heart, which helps to reduce the workload on the heart and improve overall cardiac function. Benefits of taking digoxin for heart health. The main benefit of taking digoxin is that it can help to reduce the risk of hospitalization and even mortality rates. Studies have shown that taking digoxin can reduce the risk of hospitalization for congestive heart failure by up to 30%. It also helps to reduce mortality rates in patients with congestive heart failure, atrial fibrillation, and other heart conditions. Digoxin has also been found to improve the quality of life in patients with heart disease. Studies have shown that taking digoxin can reduce the symptoms of heart failure, such as shortness of breath and fatigue. It can also reduce the risk of arrhythmias, which can lead to an increased risk of stroke and heart attack. In addition, taking digoxin can help to reduce the risk of hospital readmission and reduce the length of hospital stays. Studies have found that taking digoxin can reduce the risk of readmission by up to 25%. It can also reduce the length of hospital stays by up to 4 days. This can help to reduce the cost of hospital care and improve patient outcomes. Potential side effects of digoxin. Digoxin can cause some side effects, such as nausea, vomiting, diarrhea, dizziness, and fatigue. It can also cause an irregular heartbeat and an increased risk of heart attack and stroke. It is important to talk to your doctor about any potential side effects before starting treatment. Digoxin and congestive heart failure. Digoxin has been found to be effective in the treatment of congestive heart failure. Studies have shown that taking digoxin can reduce the risk of hospitalization and improve the quality of life in patients with congestive heart failure. It can also reduce the risk of arrhythmias, which can lead to an increased risk of stroke and heart attack. Digoxin and atrial fibrillation. Digoxin is also used in the treatment of atrial fibrillation, a type of irregular heartbeat. Studies have found that taking digoxin can reduce the symptoms of atrial fibrillation, including palpitations, dizziness, and fatigue. It can also reduce the risk of stroke and heart attack associated with this condition. Digoxin and other heart conditions. In addition to its use in the treatment of congestive heart failure and atrial fibrillation, digoxin can also be used to treat other heart conditions, such as hypertrophic cardiomyopathy and Wolff-Parkinson-White syndrome. It can help to reduce the risk of arrhythmias and improve cardiac function in these conditions. Dosage and administration of digoxin. Digoxin should always be taken as prescribed by your doctor. The dosage and administration of digoxin will vary depending on the condition being treated and the individual's response to the medication. It is important to follow your doctor's instructions and never take more or less than prescribed. Monitoring digoxin levels. It is important to monitor digoxin levels when taking this medication. Digoxin levels can be monitored through blood tests and other tests prescribed by your doctor. It is important to keep your doctor informed of any changes in your condition or any changes in your digoxin levels. Conclusion. Digoxin is a medication that has been used for centuries in the treatment of heart-related conditions. It helps to regulate heart rate and improve the efficiency of the heart's contractions, allowing for improved heart health and reduced risk of hospitalization. Taking digoxin can help to reduce the risk of hospitalization and even mortality rates in patients with congestive heart failure and atrial fibrillation. It can also reduce the risk of arrhythmias, improve the quality of life, and reduce the length of hospital stays. It is important to talk to your doctor about any potential side effects before starting treatment and to monitor your digoxin levels regularly. Thanks for watching.